Hi, I'm Dr. Toby Handler from Advanced Urology Centers of New York. Do you go to the bathroom so much that it interferes with your daily life? While it may be difficult to talk about your overactive bladder issues, there's no reason to feel embarrassed. An overactive bladder, otherwise known as OAB, is a relatively common problem affecting as many as 30 to 40% of American adults. But the good news is that with proper treatment, you can take control of OAB and live a healthy, active life without worrying about OAB symptoms. The most common symptoms of OAB are the frequent urge to urinate, urinary urgency, nocturia, waking up in the middle of the night to urinate, and leaking urine. Why does this happen? When the bladder becomes full, the brain signals the muscles in the bladder to contract, causing urine to exit the body through the urethra. Normally, this is under our control. However, for someone suffering from this condition, the bladder could contract without warning, causing frequent, sudden, and strong urges. Leakage is a common result. There are many triggers for an overactive bladder. It can be caused by certain medications, caffeine or alcohol consumption, stress, prostate enlargement in males, or other health issues. You may have some or all of these factors. Often, the first steps in treating OAB is to make lifestyle changes. We like our patients to keep a bladder diary. This is to track how often one is going to the bathroom and the amount of urine they are producing at one sitting. We also suggest that our patients make some dietary changes. This may include avoiding caffeine, alcohol, spicy foods, and also to stop smoking. Additionally, scheduling your bathroom visits or doing pelvic exercises to train your bladder muscles may also help. Other treatments for an overactive bladder include medication and Botox injections into the bladder. These options relax the bladder and help control the urinary system. Botox therapy might require retreatment at 6 to 9 month intervals. When these options do not work for our patients, we will use neuromodulation therapy, which aims to change the pattern of the bladder nerves. There are two different types of neuromodulation therapy. Sacral neuromodulation requires the surgical implantation of a bladder pacemaker to deliver electrical impulses to facilitate communication between the brain and the bladder. The second neuromodulation therapy, percutaneous tibial nerve stimulation, or PTNS, a less invasive procedure, is performed during an office visit. Our doctors place a needle electrode near the patient's ankle, which sends mild electrical impulses to help change bladder activity. Our patients usually receive 12 weekly treatments, depending on how well they are doing. An overactive bladder doesn't have to put a damper on your lifestyle. You can take back control. It's a very common problem which has multiple successful treatment options. Contact one of our physicians today at Advanced Urology Centers of New York so we can help you get the right treatment for OAB.